Every morning, millions of seniors begin the day with the same comforting ritual. The smell of fresh coffee fills the kitchen, the cup warms the hands, and the first sip seems to wake up not only the body, but also the mind. For many people after 60, coffee is more than a drink. It is a habit, a moment of peace, a small pleasure that marks the beginning of the day. But what really happens inside your body when you drink coffee every morning after 60? Is it a hidden danger, a true benefit, or something that depends on how you drink it? The first thing coffee does is stimulate your nervous system. This happens mainly because of caffeine, a natural compound that blocks a chemical in the brain called adenosine. Adenosine is one of the signals that makes you feel sleepy and slow. When caffeine blocks it, you may feel more awake, more focused, and more ready to start the day. This is why many seniors say they feel more alert after their morning cup. It may help with concentration, reaction time, and mental energy, especially during the first hours after waking up. But after 60, the body can react differently to caffeine than it did at 30 or 40. The liver may process caffeine more slowly, and the nervous system can become more sensitive. This means that one cup may feel pleasant, while 2 or 3 cups may cause shakiness, anxiety, or a racing heartbeat in some people. The same coffee that helps one person feel energized may make another person feel nervous or uncomfortable. That is why the dose matters more as we age. Coffee may also have an interesting effect on memory and brain health. Some studies suggest that moderate coffee consumption is linked with better alertness and possibly a lower risk of cognitive decline over time. This does not mean coffee is a cure for memory loss, and it cannot prevent dementia by itself. But coffee contains antioxidants, especially polyphenols, which may help protect cells from oxidative stress. Oxidative stress is one of the processes involved in aging, inflammation, and brain cell damage. So when coffee is consumed in moderation, it may be part of a brain-friendly routine, especially when combined with sleep, movement, social connection, and a balanced diet. Now let us talk about the heart. Many seniors worry that coffee is dangerous for blood pressure or heart rhythm. The truth is more nuanced. Coffee can temporarily raise blood pressure, especially in people who are not used to caffeine or who are sensitive to it. This effect is usually short-term, but for someone with uncontrolled hypertension, it may be important. Some people may also feel palpitations after coffee, especially if they drink it on an empty stomach or consume strong coffee. However, moderate coffee consumption is not automatically harmful for the heart in most healthy adults. The key is to observe your own body. If coffee causes chest discomfort, strong palpitations, dizziness, or unusual shortness of breath, it should not be ignored. Coffee also affects digestion. For some seniors, morning coffee helps stimulate bowel movement. This can be helpful for people who suffer from mild constipation. The warm liquid, the caffeine, and certain compounds in coffee may activate the digestive tract. But for others, coffee can irritate the stomach, increase acidity, or worsen reflux. If you often feel burning in the chest, stomach pain, nausea, or sour taste after coffee, especially when drinking it before breakfast, your body may be telling you to change the timing or reduce the amount. Another important point is hydration. Many people believe coffee completely dehydrates the body. In reality, moderate coffee can contribute to daily fluid intake, but caffeine may have a mild diuretic effect in some people. After 60, dehydration can happen more easily because the sensation of thirst may become weaker. So if you drink coffee every morning, it is still wise to drink water as well. A good habit is to start the morning with a glass of water before coffee, especially if you wake up with a dry mouth or take medications that affect fluid balance. Coffee can also influence blood sugar. Black coffee has very few calories and does not contain sugar by itself. But the problem begins when coffee becomes a dessert in a cup. Sugar, sweet syrups, whipped cream, and large amounts of sweetened creamers can turn a simple drink into something that affects weight, insulin resistance, and blood sugar. For seniors with diabetes or prediabetes, the way coffee is prepared matters a lot. Black coffee, or coffee with a small amount of milk, is very different from a large sweetened coffee drink. There is also the question of sleep. This is one of the most important points after 60. Many seniors already struggle with lighter sleep, frequent waking, or difficulty falling asleep. Caffeine can stay in the body for several hours. Even if you drink coffee in the morning, drinking too much or drinking it late in the day may disturb sleep at night. Poor sleep can affect memory, mood, blood pressure, appetite, and energy. So coffee may give you energy in the morning, but if it steals your sleep later, the benefit disappears. For many seniors, the safest rule is to keep coffee early in the day and avoid caffeine in the afternoon or evening. So what is the best way to drink coffee after 60? For many people, 1 to 2 cups in the morning is a reasonable amount, especially if it does not cause symptoms. It is better to avoid drinking very strong coffee on an empty stomach if you have reflux, gastritis, or anxiety. Try drinking it after breakfast or with a small meal. Choose simple coffee instead of sugary versions. Pay attention to your blood pressure if you have hypertension, and most importantly, listen to your body. Your reaction is more important than any general rule. Coffee is not a miracle drink, and it is not a poison. It is a powerful daily habit that can help or harm depending on the person, the quantity, the timing, and what is added to it. After 60, your morning coffee may support alertness, mood, digestion, and possibly long-term brain health when consumed wisely. But it can also worsen anxiety, reflux, palpitations, high blood pressure, or sleep problems in sensitive people. The real secret is not to fear coffee, but to understand it. Drink it with awareness. Keep it moderate. Avoid turning it into a sugar bomb. Do not use it to replace sleep, water, or breakfast. And if you take heart medications, blood pressure treatments, or have a medical condition, ask your doctor whether caffeine is safe for you. Your morning cup can remain a beautiful ritual. But after 60, the healthiest coffee is the one that wakes you up without disturbing your heart, your stomach, your sleep, or your peace of mind.